The SIMPCO solution is prevention.
We want to get back to the premise that people need to be better stewards of their own health care.
The SIMPCO solution is to provide preventive care through wellness education, through health education, through telehealth.
We've always said an ounce of prevention is worth a pound of cure. We want to be that ounce. We want to help people understand what you need to have in place so that when something like COVID-19 comes around, you actually already have a higher baseline level of health so that you aren't part of the statistics that say, wow, the most vulnerable individuals are faring worse. The SIMPCO solution is a series of efforts to bring public health best practices into play so that people can know how to take care of themselves for the 364 days during the year when they don't have a doctor's visit.
We think more people need prevention. We need to concentrate on that more than curative care. And so we are going to coach and help our participants to achieve healthy lifestyles.
The delivery of medical care in this country has been basically a sick care proposition. Obviously, this has not worked. The United States is one of the most developed countries in the world, but we spend close to the most amount of money, if not the most money, on health care, and our results just aren't good.
Much of the medical care in our society has been oriented toward people being sick, and often we think that we don't even need to go to the doctor until we get sick. We're not just trying to treat a condition once it happens. We want to keep you from getting that condition.
I've done enough work around the world to appreciate that what we do here in the United States embraces sick care in a disproportionate manner. We want to transform health so that we actually raise health prevention and health promotion to an equal level as sick care currently exists in the United States. So we want people to appreciate my quality of life is directly impacted by my health. And if I think about that on the front end, I'll have a healthier life, I'll have a happier life, and I'll probably end up having a longer life. There are things such as food deserts and health and medical deserts where there are no hospitals or it's harder to find a physician, for example. We want to make sure that we participate in the process of leveling that playing field so that resources are available to individuals who live in underserved communities.
One of the things we want to do is to get people engaged in their own self-care, to understand that they are also their physician, that they may in fact be their best doctor, that their health care is not something that has to just be left to someone else, but that there's some things that you need to actively engage in yourself to make certain that you stay well.
Knowledge is health, okay? We want you to actually know better because when people know better, they actually do better. They engage in better health habits. And when they do better, they tend to be better. So much of what we're talking about is health self-empowerment. We're now at the point in time where people have to appreciate you have to take care of yourself. You have to engage in healthier eating habits. You have to stay active, and you need to know how to navigate the system so that when it comes time to engage healthcare, you're not just doing it at your local emergency department.
What does it take for you to be at your best? What does it take for you to be your healthiest? And what kinds of measures do we need to arrange in conjunction with you that make that happen? We want you in the driver's seat about your health care. We want to empower you to understand that you have everything to do with what your medical outcomes are.
We want to provide health at your fingertips. So our healthcare universe will allow you to access through your smartphone, your iPad, or whatever the case may be, information. So where you can easily go to your portal, your information site, and go to a health library or to get an individual via telehealth to provide you with information or advice, to where you can engage in wellness strategies that is self-administered, where you can have a reference. The goal really in that regard is to get you to the point to where you elevate the role of health in your life so that you don't have to deal with sick care on the back end. We're going to have dozens of hours a day of lectures and personal training and things that relate to the social determinants of health, social influences of health, job training, education, enhancement, all things that we know are secondary considerations but feed into one's health and wellness, and those centers will be resource centers to that end.
You've got to be involved in the kinds of behaviors that assure wellness so that you stay well and you don't have to get well.
Be healthy, live healthy.